as of right now, the Richmond-Henrico Health District only has 180 doses, but almost 4,000 people want to get their vaccine. Even though the health district is planning on getting more vaccines each week, they say there's no way to determine when someone will be able to get their shot unless they're considered at the highest risk.
We know that the vaccine is limited, capacity is limited, just staffing, right? Capacity to vaccinate is limited.
So far, 3,700 people have filled out this interest form asking for a monkeypox shot. But RHHD says many of them are not considered at highest risk.
There are people who have filled out the vaccine interest form who don't meet any of the current risk categories, and so will likely not be vaccinated unless we were to get in a situation in this country, in the state, and in our community where vaccination was available more broadly, not relying just on those at risk.
So who is considered at highest risk? Top priority goes to people who have been exposed to someone with a confirmed case of monkeypox. They need to be vaccinated within 4 to 14 days after exposure. And those at higher risk are men who have sex with men, but exposure can also happen with skin-to-skin contact and even respiratory in certain cases of prolonged exposure. But getting those vaccines out quickly can be difficult, especially since clinics and doctors' offices do not have access to doses just yet.
There are some guidelines in terms of, even for us, like if we get the vaccine, VDH, the health department, state health department wants us to get it out to use it within 10 days, right? So we need to work with people who could do that same thing, who could turn around the vaccine and get shots in arms, pretty quickly.
Health Brigade, a clinic that works with at-risk patients, told CBS 6 it had 20 patients express interest in a monkeypox vaccine. Their information was submitted to VDH, who then told them where to get their vaccine based on location. Dr. Elaine Perry with RHHD says if more clinics or physicians showed interest in getting vaccines, it would not create a bottleneck at health departments.
One of the challenges that we're finding is that for a healthcare professional who may have a very small eligible patient population, that may not be quite that same incentive to undertake monkeypox vaccination for such a smaller subset of their patient population, as opposed to, say, with COVID-19.
Now, Dr. Perry said even though it may be hard for someone who has not been exposed to monkeypox to get their vaccine anytime soon, she said doctors' offices have ramped up testing efforts. Leland?